Good morning, everyone. My name is Dale Alexander, and we're excited to have you with us today. If you were with us in July at our Summer Jam seminar at the Georgia Aquarium, we thank you very much. If you couldn't be, that's our annual big benefits and legal seminar that we host each year. We had about 185 people at the aquarium. It was an incredible day. If you couldn't be at that day, we had a full day's content. And due to that reason, we couldn't get as deep as we wanted to go on ACA reporting. There's a lot of interest around this issue, and it's really showing. We've had our largest webinars so far around this subject. Due to the numbers of people on this call, we have you in listen-only mode. We'll take as many questions as possible. Travis will answer those at the end. So just you should see on your screen an area to type questions in. If we don't get to your questions, we'll respond personally to you. So let's get to the content, and to share that with you, here's Travis Reichert.
Good morning. I appreciate you all taking time to be with us today, and we look forward to hopefully putting your mind at ease as it relates to IRS reporting. I know that we've had an opportunity to share this message with the folks here in the districts in Georgia, and we want to make sure that because their situation is a bit more unique than it is for those of you that are with us today, we want to try to focus our time and attention and focus our efforts on telling you exactly what you need to know, making your mind feel a little bit more at ease, and then walking through just a couple of things today. The first being just a bit of a background on why are we doing this? What's the point? Are we expecting delays? Is this really going to happen? But what really is going to happen, and what's the point? Next is to kind of define what is a qualified and affordable plan, and to walk through some of the safe harbor assumptions on how you determine affordability. Next, to walk through some just practical examples of how you would actually complete the 1095-C, but also outline which forms are actually due based on your size and based on your situation. You might be fully insured, you might be self-funded, but there are a lot of similarities between districts. And also just talk about some of the types of systems that are available to assist you to make this easy. We're certainly going to teach you ways to put your mind at ease, but we want to let you know that regardless of what system you choose, it is going to be important with variable hour employees and all of this information with alphanumeric codes, just like you do with your benefit administration systems that use simple logic to make it easy on you. You're going to want to use a similar approach as it relates to IRS reporting as well. So IRS reporting background, there's been a good bit of discussion on, is this actually going to happen? We all know that the January 31st, 2016 deadline is fast approaching, and I can tell you that everything we have heard on the IRS reporting webinars themselves, as well as all the conversations we're having within the Washington, D.C. area, is that this is not going to slow down. There's been one granted extension, if you will, on e-filing, but we are not hearing any delays or any further delays on this. This is fast approaching. And so the point of this is that right now, currently, employees are able to go into the marketplace or healthcare.gov and purchase a policy, and it is difficult for them to validate whether someone should be subsidy eligible or not. So one of the points is to ensure that individuals are doing the necessary parts on their end to fulfill the individual mandate. Secondly, they're also testing the employer mandate, or are employers offering what's called qualified and affordable insurance. Qualified, defined using insurance terms, is called minimum value, minimum essential coverage. So essentially, you're just trying to test those two things, and those things will be fed through tax forms to the government to let them know, is this employer doing their part, and is the employee doing theirs? If not, they're able to assess the appropriate penalties. And regardless, and I know we have districts in different states from Arkansas, Tennessee, Florida, and things are a little bit different based on the state you're in, and we'll go into that a little bit more detail. It is not important when your plan anniversary is. It's more important to know that for IRS reporting, it is on a calendar year basis. The employee forms are going to be due by January 31st. The e-filing of your transmittal form is going to be due around March 31st unless you've applied for an extension. So let's dig in. We've got a different range of folks on the call, some as in the state of Arkansas or Alabama, that are in state-based insurance plans, essentially meaning that you don't set up your own local medical plan at your local district. You have insurance eligibility, funding, decisions, employee contributions are all made for you on your behalf based on the state. Who's eligible, who's not. For those districts that might be in Florida, however, that's a different situation. In Florida, you make all local decisions for health care, and things can vary from county to county. So with that said, I want to kind of walk through a bit of a grid that will help facilitate a conversation on kind of putting your finger on the page and understanding which box you fit in. So for those of you, and we've seen this more oftentimes really in the state of Florida only, but if you have more than 50 full-time equivalent employees and you are fully insured, let's just say, for example, United Healthcare or Blue Cross Blue Shield, there are two types of forms that have to be done. The gray section are the forms that go to employees. The lighter red section are forms that go to the IRS. Now with fully insured, it gets a little bit more complex. You've got two different types of forms that go to employees. So in that first kind of light neutral box, you've got something called a 1095B as in boy, and then something called a 1095C Part 1 and 2. The insurance company that you will have if you are fully insured is responsible for completing the 1095B as in boy. Again, that's the insurance company's responsibility if you're fully insured. The 1095C would be the employer's responsibility, and they essentially are going to be completing Part 1 and Part 2, which we will go through. Then you have something called the 1094B working your way down the page on forms to IRS. The 1094B also is something that the insurance company is responsible for doing. It's a transmittal or kind of a cover sheet, if you will, an overview of the situation that goes to the IRS with copies of all the individual 1095Bs that are handed out to the employees. Anyone that has over 250 employees is going to be responsible for e-filing or electronically filing those requirements to the IRS. Less than 250, you aren't responsible for doing that, but the vast majority of districts we work with are going to be over that limit. You then work down to the 1094C, and you have that transmittal form along with copies of all the individual employee 1095Cs are going to be the local district or the employer of record's responsibility. So again, just to review, the B as in boy forms, both the individual employee forms as well as the transmittal is going to be done by the insurance company. 1095C forms are going to be done by the employer under a fully insured environment. I believe this should only apply to Florida schools that are in a situation where they are fully insured. Self-funded employers are going to be folks like in the state of Alabama, state of Arkansas, state of Georgia, where it is a state-based, in some cases even Tennessee, where you have a state-based insurance trust that is set up on a self-funded basis where you are a party of that plan. So in that particular instance, unless you have gotten different direction from the state agency, the plan sponsor is generally going to be the employer. Most of the states have let districts know that this is your responsibility. We are here to help in some limited capacity, but ultimately the responsibility is up to you. So in that instance, if you're self-funded, the middle column there, and you got forms to employees, you are responsible for the 1095C, all parts, Part 1, 2, and 3, and we'll go through that. Again, that is the plan sponsor, generally the employer. You then have the cover sheet, as we talked about before, called the 1094C, with all of your copies of individual 1095Cs that are going to be responsible to be e-filed. And again, generally that is going to be you, the plan sponsor. So again, self-funded employers in the middle, the individual electronic employee forms of the 1095C, all parts. The transmittal or cover sheet is the 1094C with the individual copies of the employee forms along with it. Again, that's generally going to be done by the employer. Now, one area of interest, and this has been confusing for some people, is a lack of clarity around folks that are not actually employees. And so many districts do have COBRA employees, and also a good number of them have retiree coverage. So one of the questions we've always had is, if you're in a state-funded health plan, is how do you know who is on COBRA or who might be a retiree? Sometimes that is controlled by the state and not by the local district. So just so you're aware, COBRA and retirees, because they are not active employees, are required to fill out the 1095B. Now, it's a different situation in Georgia than it is for other states potentially, but that's a question you're going to be wanting to ask the state. If you're in, let's say, for example, Arkansas or Alabama or Tennessee, and you're part of a state-based insurance trust, you're going to want to ask the agencies, what responsibility do we have around COBRA and retirees? Are you assisting us with that, or is that our responsibility? For those of you in Florida that are not part of a state plan, you're making all your own local decisions, you will be the party of interest, the plan sponsor, generally the employer, that's going to be responsible for the 1095B, which are the individual employee forms, and then the transmittal form, again, the 1094B. There's very little difference between the B and the C forms. They're essentially, once we show you the C form today, there's a lot of transparency between the two, or similarities. So fundamentally, all of this starts with, is our plan qualified and affordable? Now, I don't have the ability to see every single person's benefits that are on the call today to answer this, but I'm going to generalize things because we work with nearly 70 school districts across the country. Because some of you are in state-based insurance programs like Alabama and Arkansas and Georgia, we've seen those plans. Qualified means that they meet the minimum value, minimum essential coverage limitations set by the law, and I have not seen any school district across the country that doesn't meet that requirement. So that's usually just a quick and easy check. Your plans are going to be qualified. Affordability, on the other hand, is done at an individual level. And so essentially what you're doing is you're trying to determine from an employee's perspective, from their cost, not the school districts, but the employee's cost, what is 9.5% of the single coverage only section. So as an example, how you would determine affordability can be done one of three ways with what's called a safe harbor. And we'll go through each of those. One is called the rate of pay. One is called W-2. And one is called federal poverty level. Whether you're in any state, be that Florida, Arkansas, Alabama, Georgia, Tennessee, most of the time we have found, because of the generosity of the school district, that federal poverty level tends to be the best fit. Let me just walk through that quickly. If an employee only annualized income for federal poverty level is $11,770, and then you take 9.5% of that number, that would be an employee contribution of $93.17 a month. So what I'm saying is, so long as your lowest cost option that's qualified and affordable, you may offer multiple plans, but so long as the lowest cost plan you offer meets the minimum qualification standards, and the cost to the employee only for single coverage is less than $93.17, it will greatly reduce and simplify your reporting obligations to go ahead and use federal poverty level as an actual safe harbor. Most of the districts we work with are going to pass that test. But let's actually walk through just a couple of the others, because there's a good bit of attention on W-2. W-2 safe harbor would say, what is 9.5% of the employee's income looking at box 1 earnings, which, as you can imagine, can be reduced with contributions to retirement plans, insurance plans, flexible spending accounts, etc. So that reduces one's income when you're looking at 9.5%. This is done at the end of the calendar year, so from a practical standpoint, you don't really have an ability to understand whether it's affordable or not until at the end of the year, and so that provides somewhat of a limitation. And you cannot change an employee's contribution level during the year. I don't think we've seen that, but that's one thing you have to do as a limitation of W-2 safe harbor. We talked about the federal poverty level, the second one there, where so long as your plan is qualified and the employee's amount of the deduction is less than $93.17 a month for the calendar year 2015, that would be the easiest one to use. But there's actually a third, and it is called the rate of pay method. Most of the time this comes up with hourly employees, but you can do a conversion for salaried as well. But essentially what you're doing is taking 9.5% of an hourly rate at the beginning of a start period. You have to assume, though, that 130 hours worked during the month is what you use, regardless of actually what an employee would work, because 130 hours is considered full-time now, which is the average of 30 hours a week. So you would be using and assuming, regardless of how they worked, that affordability would be based on 130 hours. And then for salaried employees, you're looking at monthly salary at the beginning of a coverage period. There's also some further dialogue about if you do use salary and salaries are reduced during the year, this method cannot be actually used. So if you have stable workforce, stable salaries, you want to only test this one time a year, rate of pay could be a good solution. And then if you're paid anything other than monthly, which I don't believe that will come up on this call, you can use other reasonable methods to convert to a payroll period to a monthly salary option. So again, you have three different ways to determine what is affordable. How do you define 9.5% of what number? And for many of you, I believe the easiest is going to be not doing a calculation with rate of pay or a W-2. I believe so long as your deductions are less than, again, $93.17, that federal poverty level will be the easiest for most of you. Let's take a look at the sections. Many of you have probably looked at this, but I wanted to just take a minute to put your mind at ease and walk through a couple of practical examples that school districts are facing as they do these reports. The first is part one. You're looking at the 2014 form because that's the one that is truly finalized. 2015 it does not have very many changes, but for the purpose of the webinar, I think we're fine using this one. Part 1 through 6, which is that middle box, is the information that you put for each employee. Their name, social security number, address, city, state, and zip. That's going to be individualized for each employee. The very last box is information from the school district, and that should not change for any of the 1095-C forms. You're just putting the name of the school district, the EIN, address, city, state, zip, and then a telephone number. That's the easiest one. When you get into part 2, this is where it becomes helpful to have a technology solution to help you with all of these various alphanumeric codes. And we're going to go through some practical examples again, but I just want to give you a frame of reference on what you're looking at. Line 14 are what's known as the Series 1 codes, which is 1A through 1I of possibilities. And it's essentially saying, are you offering coverage to individuals? And the first section is, do you offer it all 12 months? If so, you can just fill out that column by itself. Or if you're actually offering coverage or you have new hires, you can do things by month as well. Line 15 is the actual cost for employee-only coverage. So what is the actual monthly deduction that the employee pays for that qualified plan? Perhaps it's $65 a month, whatever that dollar amount is, the lowest cost monthly premium for self-only. Then line 16 is really to build upon line 14. That's called the Series 2 codes. Again, it goes 2A through 2I, much like Series 1 is 1A through 1I. And what you're doing is trying to decide what is the applicable safe harbor there in terms of, are those people enrolled in coverage that was offered or are they not? So let's take a look at a couple of examples. I think what most of you are going to find is that the vast majority of your workforce is going to be in one of these first two categories. School districts are already more generous than they have to be based on the law. So the law really was not intended to be directed towards school districts. You're already very generous with who you offer coverage to, well beyond what the law is required to do, such as bus drivers, food nutrition that are working 20, maybe even only 15 hours. But there's only a requirement to do it for 30 and above. So you're already in a position that you're offering coverage to more than you have to, which is why this is going to be easier for a school district than it would, say, a Waffle House or some type of retail or someone in hospitality. So if you had someone that was first had a qualified offer of coverage, which again, most employees do, all but for the most part substitute teachers are offered coverage, and you used the federal poverty level safe harbor from before, all you would be responsible for is entering on line 14 the code 1A. That essentially is saying that you've offered a qualified offer of coverage using the federal poverty level safe harbor. You're able to skip line 15 because they already know that it's affordable. If you used a different code there, you would just put the amount. Then in line 16, you're basically just putting the code 2C, and all that simply means is that the employee enrolled in coverage. There's lots of different alphanumeric codes that could apply, but you're only supposed to put one. 2C trumps everything. So all we're doing again is if you offer coverage, that's 1A, and if the employee enrolls in coverage, that is 2C. It's really that simple. But you might have a situation where you offer coverage, but someone does not enroll. And there has been some confusion out there, but sitting on some of these IRS conference calls and webinars are hosting, I can confirm this is true. The only difference between this screen and the last one is that line 16 is blank. So let's just review it one more time. Line 14 says that you're offering coverage, which is 1A in line 14. And then in line 16, because they are not enrolled in insurance, instead of putting 2C, which is they did enroll, you just simply leave it blank. So that is going to be the vast majority of your workforce in these first two slides. There are a couple of other exceptions to that I wanted to go through. For example, what about we just got through new hire season? And so let's walk through maybe probably one of the most complex situations, but as we walk through it, I think you'll start to understand it's not maybe as bad as it looks. Let's say that in January that there was no coverage offered to an employee because they weren't employed at the school district. So what you do is you would put 1H for the month of January because they were not offered coverage, and then you put 2A on line 16 because they weren't employed there. So 1H says they were not offered, 2A said they were not employed. It's the first bullet point. But let's say in February they're now eligible for coverage, but they're in their waiting period. So February again would be 1H because you're not offering them coverage yet. And then you're just simply explaining why on line 16 that says that they are in their waiting period. Now at that point the waiting period ends. So in March they have an opportunity to enroll or not enroll. So from March through the rest of the year, what we're showing in this example, from March, April, May, June, etc., that you offered coverage, very similar to the first slide. 1A means you're offering it based on the federal poverty level safe harbor. Then on line 16, again from March through the rest of the year, you're simply putting 2C, again because they are enrolled. The only difference you would do from March on is if someone was offered coverage and not enrolled, I think you would guess this already, you would just simply leave line 16 blank because they were not enrolled. Okay? That's probably the most complex one that people have had questions on. The second would be, what happens when we're already offering coverage to people that are actually working less than 30 hours a week? Folks like bus drivers, food nutrition, etc. Now, I'm going to assume that these individuals are there all 12 months, but this one is where you would say you are making an offer of coverage again, but the only difference is the code you're using. Because they're technically less than 30 hours a week, which is not considered full-time in the law, you're actually going to end up using code 1E in line 14. And then in line 15 is when you're actually putting the cost of coverage. I just put as an example $66.28 is the employee-only cost for the lowest self-only minimum value plan. And then just like you've seen on all the previous slides, if they decide to enroll, you're going to put 2C in line 16. If you are not enrolled, again, you would just leave that blank. So as an example, you've got a bus driver that is on the plan all 12 months. They work less than 30 hours, so they work 25 hours a week. You would put 1E that they're offered coverage, put the amount of the insurance cost to them, and then lastly on line 16 you'd put 2C that they were enrolled. The last thing is just a little bit more on substitute teachers. A couple of things, and it varies by state, it varies by districts within that state. But this is an extremely important piece of clarification that I want all of you to be aware of. You are only required to provide a 1095-C if someone is considered to be a full-time employee working an average of 30 hours a week. Now, we've talked about in previous webinars, how do you determine if a substitute is really working on average 30 hours a week? You've heard us talk about measurement periods, administrative period, stability period. Again, the measurement period is the period of time that you're averaging the hours. We recommend using a 12-month period of time because even for a long-term sub, hours can fluctuate. It could be that they're only working there on a regular basis for 90 days. Then they don't work for several months or they work limited hours. So you're able to average their hours over a 12-month period of time to come up with, are they working 30 hours? From doing analysis all over the country with dozens and dozens of school districts, from the very smallest to the very largest with over 10,000 employees, we have found consistently that when you look at a substitute teacher's hours averaged over 12 months, that you simply probably are not going to have very many that even get to that 30-hour-a-week requirement. Therefore, going back to this bullet point, you are only required to provide the 1095-C to those actual substitutes, as an example, that are actually working on average 30 hours or more a week. The other thing we have heard, and this is just some protections I want you to be thinking about with your in-house counsel or external lawyers if that's something you use, some folks are actually outsourcing substitutes. Now there are business reasons for doing that, and then there are healthcare reasons that some people have done that to avoid the Affordable Care Act requirements. I just want you to be careful that the law just simply outsourcing them does not mean that they are still not potentially your responsibility. They still could be considered what is called a common law employee. There are many different practical kind of examples you could walk through, which is who provides them oversight, where do they work, are you supplying the materials. There is a kind of a 2-page checklist we can make available on the website to give you an idea of what could be considered a common law employee. But it's important if you are outsourcing, as an example, like I know some of the districts do in Florida to say Kelly Services, that you are working very carefully with them and have designed your contract in the right way that you fully understand what their responsibilities are and their obligations to make sure that those employees are covered correctly as it relates to IRS reporting. What you don't want is an unpleasant surprise that you spend all this time and effort outsourcing them and then you find out that they're also still your responsibility. Lastly is 1095-C Part 3. As we go back to who's responsible for Part 3, it's important to know that this is only needed if you are a self-funded employer. So Georgia, Arkansas, Alabama, Tennessee, some of the larger districts down in Florida would be in this situation likely as well. But if you're self-funded, you are also responsible for completing the last part, Part 3, where you're essentially, as I walk through line 17, you are discussing who are the covered individuals on the medical plan. What is their name? So, for example, Travis Riker, what is my social security number in Part B? What is my date of birth? And then what months were I covered? Lines 18, 19, and 20 would be where I would put, if I had family coverage, I would also need to put my wife Sally's name and also my children's name. If a social security number is not available, they do allow you to use date of birth. I would just tell you that a social is more than likely going to be more accurate. And again, you're just putting what months they're covered. And then that is really the last section of the form for you to be aware of. If you are a fully insured health plan that likely is only going to come up in the state of Florida, you are not responsible for Part 3. Those obligations are taken care of by the insurance companies on the B as in boy forms. Just to kind of conclude at a high level, how do you manage all of this? Certainly, things can be a little bit complex in that you are completing the 1095-C for employees that are working 30 hours a week or more, as well as for employees eligible for coverage less than 30 hours, such as bus drivers and food service. So again, you have to complete the 1095-C for full-time employees working 30 hours a week or more, as well as for employees that are eligible less than 30 hours a week, bus drivers, food service. The 1095-B is going to be for those COBRA and retirees or for the fully insured plans. They're going to be responsible for completing Part B. And the one thing that's been very consistent as we work with district is the need for an electronic system. Again, we know that we and other advisors work on behalf of schools to allow online enrollment where employees can simply log into an easy-to-use system, make their elections, rather than using a paper enrollment form. And then what that does is creates a real sense of efficiencies for the administration officials as well as the convenience that all that information can be sent out to any of your insurance companies and vendor partners electronically, with rules built in on how eligibility works and the rules of when dependents age out, etc. Well, that same logic is what is done in third-party systems. And you can get a variety of systems to assist you. And I know we've talked to various school districts that have multiple options, but they really come down to these three. You can use your payroll provider. They can build in some ACA functionality to look at variable hour employees, as well as producing the necessary forms. You could look at a benefits enrollment software solution, some of which that we use, that you can turn on a button to turn on the IRS reporting and variable hour employee tracking. But there are also third-party systems. And so there are pros and cons of each to consider. But I do want to strongly emphasize that I do think it is going to be in your best interest to use some type of electronic system. I wanted to just go one layer deeper, and then we'll conclude and take a look at questions and see how we can assist. But how would you pay for this? What does this look like? So there are really three different ways that you're going to have access to IRS reporting tools. You can go direct to providers, whether that be a third-party payroll, benefits enrollment. Those systems can be more expensive. But you're really not sacrificing any quality of the insurance products that you offer. It really doesn't have any impact. They're a compliance solution. You have access to them. And depending on the size of your district, you might have more leverage than the other. The larger you are, the more leverage you have. You could also go through an advisor-supported model that knows about how your medical plan works. They consult with you on a regular basis. And they also have access, as we have access to tools, where because of our national aggregation, if you will, and our national presence around the country, we get that same solution for half the price. And again, you're not having to sacrifice product quality. Why we bring that up is that there are some insurance companies that will provide what they call a free solution, which nothing is free. What they've done is they've just simply maybe not offered the most competitive or the most generous benefits available in the marketplace to you, but then they've just subsidized the cost of that system for you. So there are different models that are available to you. Each of you have advisors around your areas that can assist you. We would be honored to assist anyone that would like any help in that department. And we have a couple of different models that we have as options that are going to be at those cost numbers and potentially even a good bit less. So I wanted to kind of wrap things up there, take a minute to just put things on mute for 1 second. let me take a look at several of the questions that have come in, and then let me report back to you. Also, if this is a highly complex situation, something that we need to follow up, we would have the email addresses for everyone. If I need to do some additional research, I can, and we will make sure that we get back to everyone as well. I believe we are also putting this webinar, which is the most common question we get, just as a refresher. Today's webinar, we're not going to worry about sending you the slides. We're going to do what we think is one better than that. We're going to actually put the whole presentation, the audio content, and the slides on the website at cafe125.com/webinars, so it's accessible to you 24/7 to share with your staff, etc. Give me just 1 second. There's a question about averaging 30 hours a week. How does that work? So there are different ways that you can create measurement periods. For example, if you were a calendar year plan, let's say for one of our clients down in Florida, you want to think with the end in mind. So you want to start with the stability period and back yourself up. And again, this is on a visual and an audio on our website as well, which sometimes is easier. But you would have, let's say 1/1/15 is the start date that you have to be ready for. I would back up, for simplicity, roughly 61 days, which is 2 months, for the administrative period. So you have 61 days to kind of do the calculation, get them enrolled in benefits if that's necessary. So that would be kind of November 1st of 2014 to December 31st would be your administrative period. That's the period that you're going to actually do the calculations and get them ready if you want to offer them insurance. Then you back up 12 months from that. So what you really should have been doing is looking at the hours worked from November the 1st of 2013 through October 31st of 2014. Because again, you have to be ready to go and understand who should have been enrolled or eligible for the plan on 1/1/15 when the law became effective. Now there's also, in between that time period from 11/1/13 to 10/31/14, there are breaks in service. And so there's a special rule for schools that says if there is a break in service of more than 4 weeks, you cannot use that against the employee. Let me give you one example. Maybe the easiest is you don't work during the summer. I'm going to simplify this. I know the dates are not exactly overlapping, but let's say June and July, you are off for summer break. Say that's an 8-week period of time. You did not offer, if you will, that variable hour employee, that substitute teacher. There was no opportunity for those individuals to work. And so you can't use those hours, which would be filled in as a 0, against them. You have to give them credit for actually working that time towards the overall average of hours, or you have to carve that out of a calculation, if you will. Again, there might be some better visual with audio on our website that would help you. There are also 2 different types of measurement periods and stability periods. There's one for what's called ongoing employees, and there's another for new hires. And so for every new hire, you have to transition them and be concurrently tracking both. Again, if you have technology solutions available to you, that's another reason why I highly encourage you to consider that. All you are going to be responsible for doing is collecting some basic data and importing that into the system, and the system is doing all of the hard work for you. They're doing the calculations. They're showing you graphically who is approaching 30 hours or not. They're giving you easy-to-use reporting menus and navigation bars to know. And probably most importantly, when it's time to file these requirements of the 1094C, the 1095Cs, that you just literally, once that information is into the system, you can click a button and all of this comes out in the right manner. Another question we got was around, do we get an extension for this first year? Are we responsible? It is important to know that these are tax forms. So we want to do our best to complete this information as accurately as possible, because if there are mistakes on the codes, employees have a potential penalty on their taxes. They're just going to come to HR or payroll and ask for a revised form, if you will, or clarification on why it was done that way. So it could create extra calls and resources. But I want you to feel a bit more comfortable that it's important in this first year that the IRS has been clear that good faith compliance is what's required. They're asking you to try to do the right thing, to have your systems and processes in place to get this right on behalf of the employees. But again, good faith compliance. There's not going to be any penalties. There's only going to be penalties for those that just choose to ignore it and not do anything. Just taking a look here. The last question that someone had asked is do we offer any types of solutions to assist districts? We do. We would be more in that advisor-supported model. So if there's something that we can do to share with you more about how we're assisting districts, we'd be happy to do that. Also, I think you do want to check in with each of your, at least in the state of Arkansas, Georgia, Alabama, and Tennessee, where you're in a state-based medical plan. You want to be asking them what they are doing to assist you. If you are in those plans, you are in a good position to fill out Part 1 of the 1095-C. That's going to come most likely from your payroll system. If you're housing your information in a benefits management system, it would be there as well. But there is going to be no ability for you to fill out Part 3 without the assistance of the necessary reports from that particular system. They're going to have to tell you who is enrolled and by what month. So just be thinking about if you're not in control of that data through your own benefits administration or enrollment system, that you are going to be reliant upon the state agency. In the state of Florida, that is not an issue. You're either going to go to your insurance company and get a record of which employees are enrolled by month, or you're going to have that already in the system that you're using for online enrollment, as we do with other clients. For those clients that already have that information in a system, reporting is going to be very, very easy and a lot more efficient. There's a lot less work that has to be done to assist those individuals. I think that's all the questions. Again, my name is Travis Riker, the healthcare practice leader. It was an honor to be with you today. Hopefully this has allowed you a little bit more comfort that maybe this isn't as bad as it looked like. The key takeaways for me are you need to be collecting the hours worked for your variable hour employees starting no farther or no less than probably 3/1 of 2013. Be doing that analysis. Be ready to understand if those individuals are impacted or not. And then lastly, be working with your advisors or find an advisor that's a true healthcare expert because that's really important here to understand what systems could be available to you to make this an easier project than it could be on your own. But we really appreciate you. Again, the webinar will be recorded today and posted at cafe125.com/webinars. We likely will have that posted in the next couple of days. I hope everyone has a great school year. I know it's been fun for me to watch my little girl start kindergarten, so I look forward to talking to you all soon. Have a great day.